Hi, I'm Kathy Henry. I am a licensed clinical social worker in the Indianapolis area, and I am proud to work for Healing Hearts of Indy. Is your pain too great? Who gets to say if it's too big, too small, or just right? When trauma strikes, make no mistake, you will feel the pain of it. And you may sense that you are being judged on the level of pain that you feel. In fact, you probably are. Most people are going to have an opinion on how much pain you should have on a given circumstance. So here are a few tips to keep in mind when you are in pain. Number one, validate yourself and for yourself. The pain that you are feeling is going to impact those around you: spouses, children, parents, siblings, friends, co-workers, you name it. And not everyone is going to be comfortable around high levels of pain. So they may attempt to regulate your pain for you by convincing you that you should feel pain at a different level, either more pain or less pain, usually less. And if they are in fact the one who hurt you, then they are probably motivated to lessen your pain for sure, because then it minimizes their pain. But you get to decide for yourself how much pain you get to be in, how much it hurts. So the point is, it does hurt, period. Nobody gets to tell you that it doesn't or that it shouldn't hurt. So for you, one of the things for you to do is to learn how to validate your own pain instead of looking to everyone else's reactions to tell you if you're in the right amount of pain or not. Number two, assign appropriate responsibility. Now this one's kind of hard. If you're feeling extreme pain, some of it may not be due really to what's happening to you at that moment in time. When we have had past hurts, and we all have, usually from our caregivers or our siblings or other people in our lives when we were growing up, sometimes we have a wound. The wound that we are currently experiencing is kind of hits right where it hurts from our childhood. So for an example, if you can imagine that you had a broken leg as a child and that break was pretty severe and you had to have it surgically repaired, and you may even still feel it once in a while. It may ache once in a while, or when it rains, or you might even walk with a limp still. Now imagine that someone comes up and kicks you right in that exact same spot as an adult. It's going to hurt you more than if it had never been injured, if you'd never been injured in that area. Is the person responsible for kicking you? Of course they are. Was it okay for them to kick you? No, it was not. Of course not. But on a scale of 1 to 10, a person who never had a break might feel that kick as a 3 or a 4. The person who had the break and the trauma and the injury and still limps a little bit might feel it as an 8 or a 9. The pain is excruciating, yes, but the pain is not 100% due to the person who kicked you, even though you're still going to be upset with them for kicking you. So keep in mind that even though you feel great pain in the area that where it was inflicted, it may not all be due to the person who kicked you or who hurt you. Number 3, consider your pain tolerance. Much like physical pain, we all have different tolerance for emotional pain as well. Some of us are extra sensitive, and the tiniest hint of pain will stop us in our tracks and make us feel like we can't even make it through the day. Others of us have an incredibly high tolerance for pain and work through it, kind of like a World War II hero. So we need to be able to be honest with ourselves about our emotional pain tolerance. So it probably aligns pretty well with your physical pain tolerance as well. If you have a high physical pain tolerance, you probably have a high emotional pain tolerance. If you have a low physical pain tolerance, and you probably also have a low emotional pain tolerance. So you may be feeling pain at an intensity that is too high for the circumstances, and or attributing too much of your pain to the circumstances, like we talked about before with the previous injury. Likewise, you might be someone who is kind of like a Timex. It takes a licking but keeps on ticking, and you get knocked down and you just get right back up and keep going, and you don't make any changes because the pain is not that great for you. So if you are in pain, I want to encourage you to find someone that you trust to help you see clearly what would be the appropriate amount of pain to have for your situation, to help you to be able to see the things you can't. Like for when it might be attributed to something that doesn't have anything to do with the person who hurt you. Likewise, you might need someone to help you understand that a lot of the pain that you're feeling is because you have a very low tolerance for pain. And on the other hand, you might be someone who should be in much greater pain than you are because you keep getting walked on or abused or whatever, and you just have a high tolerance for pain, and maybe you need to be in more pain in order to make some changes in your life. So these are just a few tips to help you out to learn how to validate your pain for yourself, to assign appropriate responsibility for the pain, and also knowing your own pain tolerance. And all of these can help you to feel better faster and help you find a healthy balance that's right for you. So thank you very much for listening today.